Trying to conceive can be a roller coaster of emotions. As with other problems that people can see, people think they have the reserved and exclusive right to keep bringing up suggestions. They just make you feel like you are not doing enough. So I came to tell you today that you're not alone and there are lots of options out there for you. So there are tests that can help ease this stressful journey. These tests, some of them, they are DIY. You can do them on your own at home, and some of them you actually need to go to a hospital to do them. Hi guys, my name is Edidion, and today I'll be talking to you about fertility tests that you may know or you may not know they are available to ease your conception journey. So please don't click out, stay to the end of this video. And if you're new, you see me for the first time, please subscribe. Okay, so there are ovulation tests that are available. Like I said, you can do some at home by yourself. The first on this list is basal body temperature test. Now, when you hear basal body temperature, this means temperature of the body at rest. So if you are ovulating, for example, you may experience a higher body temperature. Now, there are kits and fertility trackers that can actually help you with tracking this basal body temperature. Some are wearable devices. They actually check basal body temperature, heart rate, and some other fertility indicators. We also have ovulation prediction kits. This kit actually tests for luteinizing hormone. Now, if there's a surge in this hormone, it means that you're actually ovulating. So there are test strips that actually test for this hormone, and this can help you, can go a long way. So you may want to try that. You can also get a blood work to test for fertility hormones. For example, the follicle stimulating hormone, that's to assess ovarian function. And then the luteinizing hormone I mentioned earlier to dictate ovulation. And also the progesterone level test to confirm ovulation. So there are also ultrasound tests you can do. A transvaginal ultrasound, for example, tests for ovarian function, follicle development, and detects ovulation. Then you can also do a pelvic ultrasound. This checks for any abnormalities in the reproductive system. You should also get a thyroid hormone level test. Thyroid disorders actually affect fertility. Then a prolactin test too. High levels of prolactin can significantly affect fertility. Now we get to the most important part of this video, the advanced test that nobody talks about. Maybe you've not heard of this, or maybe you have reservations for this particular test. So I'm going to be talking about, that's the bonus of this video. So for advanced testing, we have the IVF testing. Now, if you do not know, IVF stands for in vitro fertilization. This testing actually evaluates egg and sperm quality as well as embryo development. Then we get to laparoscopy. Laparoscopy is a minimally invasive surgical procedure that examines the reproductive organs for abnormalities. Then the last one, this particular one, I am going to be telling you the side effects of this particular one in case you're willing to try it out, which I think you really should, but you should discuss with your medical professional. So I'm talking about the hysterosalpingogram. A hysterosalpingogram, otherwise called HSG test, is a diagnostic imaging procedure that helps to evaluate the female reproductive organs, specifically the fallopian tubes and the uterus. This is an X-ray examination that makes use of a contrast agent to visualize the fallopian tube and the uterus. It helps to dictate blockages, abnormalities, and damages to this reproductive organ. So there are a number of reasons why this test is being done. The first is to investigate infertility. That's check for blocked tubes, abnormalities, damages. The second is to evaluate tubal patency. Like I said earlier, I check for blocked tubes, just anything that may be contributing to infertility. This test is also done to check for abnormalities in the uterus, like fibroids, polyps, and any other congenital abnormality that may be present and may be contributing to infertility. This test can also dictate damages done to the fallopian tubes, maybe by infection, during surgery, or other conditions, any condition that may be contributing to infertility. This is what this test checks for. This test is generally safe, but as with any minimally invasive procedure, there are side effects to it. You may experience mild discomfort. This mild discomfort may be in form of cramping. You may also notice spotting or bleeding after the procedure. You may also notice an infection because, like I said, it's minimally invasive. You may also notice an allergic reaction because you may be allergic to the contrast agent, which is used to visualize these reproductive organs. So these are the side effects to expect after and maybe during this procedure. The results are usually in a few days, but if you have any concerns, I think you should talk to your healthcare provider, any concerns at all. So these are the options you have open to you when it comes to fertility tests. And I know it's a little biased because I just mentioned the ones available to women. But I don't know, depending on how much traction I get on this video, I may do the one for men soon. Who knows? So comment if you want to see that particular video. You know, in Africa, most people blame women for infertility. And that is why, even if the problem is coming from the man, they do not even bother to check. They just think it's the ladies. So I hope this is not sensitive for you. And I hope you learned something. Hopefully you learned something. So please subscribe, leave me a comment, like this video so other people can see it. I will see you in my next one.